And we're going to put together some smaller workshops to really get some hands-on technical assistance. And so we hope that the major workshops will help advance a lot of your challenges, but that we're going to be able to provide more one-on-one and specific training to really help all of you advance in your areas of work. So we are, as I said, providing these workshops, going to provide technical assistance, and we hope that all of you, if you can't make the workshops, will view them online. We are recording all of these, as you just heard, and then will give us feedback to help move into the next phase, which will be more hands-on technical assistance. These are the workshops that are forthcoming. Our next one is next Friday. But if you miss anyone, we'll put them online, and you're welcome to join all of the ones that we have. We hope you find this helpful. We are starting today with a presentation to launch kind of the questions around approaching disaggregating race and ethnicity data. And I'm very pleased to have Dr. Ninez Ponce, who has been a longtime expert and leader in health equity research. She has really devoted her career to this. She was at the start of the California Health Interview Survey, which is run through our center, and really pushed for as much disaggregation right from the beginning as possible. She is currently our center director and the PI of that survey, and continues to expand on what we can do in disaggregating data. And she has served on many national committees and boards and contributed to reports about how you and others can achieve as much disaggregation within your populations as you can. And so I appreciate that she was willing to give us her time today, and I am going to turn it over to her, Dr. Ponce.
Thank you, Dr. Scheitler. I seem to be the bouncer here, and I'm admitting people, so I'm going to hand off the admission to you. So we also just started recording. We had envisioned, we actually expected only about 50 people to sign up for this, and we've gotten hundreds. In fact, we may have to close it at 300 for this meeting. We decided not to shift to a webinar format because we do want to make sure this is interactive. And I'm glad some of you do have your cameras on so that it will feel like, this is a learning community, and we are sharing some of the knowledge that certainly I'll share some of the knowledge I've learned through the California Health Interview Survey, and prior to that as a data equity advocate, but really encourage you to use the chat function to add to the conversation in terms of your experience. This is a meeting, a Zoom meeting, not a webinar. So actually the Q&A function does not work. Or is not part of this. So put everything in chat, please. I have a great team that is going to be monitoring the chat in addition to Dr. Scheitler, Dr. Sue Babby, and Dr. Riti Shimkata, and our Director of Communications, Tiffany Lopes, will be monitoring. And I also believe, and as I scroll through the multiple pages now of the squares, that we are joined by some CHIS team members who can also answer in the chat perhaps more quickly if you may have a specific question or a detailed question that I may not get to as I'm speaking. I do think the best way to go through and share information with you is to go through the kind of didactic parts, or the nuts and bolts of the Office of Management and Budget guidelines, and then we'll have time for more interaction in the Q&A version. So with that, I'm going to, I think everybody is muted. I may mute everyone for now. We've certainly gotten a lot of Zoom bombers in the classes at UCLA. I don't know also in your meetings for some of you, but I'm going to mute. Oh, I think you can just, I'll leave that to either AJ, Sue, or Riti to fix. Okay, let's get started. It's 10:12. Today's talk is like, why do we do this? Well, because we, particularly in survey research, but in all data ecosystems, is that we want to reflect the population that we are interested in terms of trying to improve health and to achieve health equity. So I'll go over some of the data collection information and suggestions, a little bit on processing. And as Dr. Scheitler said, there's going to be, this is one of several technical assistance workshops. So I'll go over the, again, I said, data collection, racial ethnic grouping, and classification and reporting. And then our case studies are, just answering, I think, two of the questions I always get when I give these talks or I go to professional meetings, which is like, how do you choose? How do you choose which languages? How far do you go, in terms of disaggregating data? And then the really important question is then, so we want to do this, the willingness to pay is there, but the ability to pay and how to pay is really important. So we'll talk a bit about that today. First, I'm going to run a poll, and let me just see if I can this. Ask about which census regions are you from, since some of us are survey researchers here. So I'm going to launch the poll. So far, a very good response rate, 83%. 85, 86%. I'm going to call it at 90%. So get your votes in. Well, no, it's still going. I'll share the results, but there's actually a lot from 42% from the Pacific region and the South Atlantic. So I'm gonna, and second, I'm gonna stick with my precision of 90%. We're at 89% voting. Okay, it's 3 seconds, no move. I'm gonna end the poll. And I'm gonna share the results here. So as you see, it's not just California that's represented, but we have many people who are here who are from, there's some from New England. Welcome those from the New England area, the Mid-Atlantic area, South Atlantic, East, somebody from East South Central, or two people, many from East North Central and West North Central and Pacific region, and outside the US and Washington, DC. I did look at the participant today. I don't know if this person is here, but somebody from Australia is joining us today. So welcome. And these are census regions designations. I'm going to launch the next poll, which is, are you predominantly a data producer or a data consumer? This time I'm just going to keep it open for 30 seconds. So we're at 15 seconds, 16 seconds, 20 seconds. Okay, we're down to 28 seconds and we're at 30. I'm going to end the poll and share the results that we are tilting towards more data consumers than data producers here. And knowing that many of us here, I know I am, I'm both a data consumer and a data producer. So welcome. And since we do have a lot of consumers, especially in looking at the list, many advocates, some of what I'll cover today may be, very familiar to you, but it'll be just good to quickly review it. And we will have the slides available and the recording available. All right, the next slide, type of organization. So we'll do organization type and launch the poll there. Again, I'm going to call it at 30 seconds. Okay. 14, 15 seconds, 16 seconds. Okay, and 21. See people still entering the room. And for those of you who don't want to keep seeing the poll, there's a red button in the bottom to close it. So I overran, it's 40 seconds. I'm going to share the results here. And it looks like there's a preponderance of academic research institutions. There are advocacy community groups. Thank you. Welcome. Some consultants, research services. I'm happy that there are healthcare system providers here in the room, and no legislative policy. Interesting. Much to do in terms of disseminating the work here for legislative policy, public policy folks. Some funders and nonprofit organizations are in the room. Thank you. And administrators, the public health agencies, federal, local, and state. I wanted to thank each and every one of you in public health and for fighting this pandemic. So thank you for being here. So I'm going to now stop share, and then we're going to end the poll for a bit. We'll come back to some polls later on. Let me just, all right, OMB Directive 15, Office of Management and Budget, Directive 15. So in 1997 was the most recent revisions. Prior to that was 1977, then revised in 1997. It has not been revised, although lots of discussions in its revision. The main changes in the 1997 federal standards of race ethnicity reporting was to include or to disaggregate the Native Hawaiian or other Pacific Islander category from the Asian category, which previously had been aggregated together. Another change in the 97 directive was that instead of being confined to choosing one race, that you can select one or more or mark one or more, and that there would not be a category that would be a multi-racial.
Inez, you just accidentally got muted. Can you please unmute there? Sorry, we didn't hear the last few things you said.
Oh, I know. Oh, okay. So really quickly, so OMB 1997 follows the 1977 OMB Directive 15. There have been no changes since then. The big changes are that the Native Hawaiian Other Pacific Islander population, the category is disaggregated from Asian, and that now a person can select one or more of these categories. The other stipulation is that there should not be a category that is multiracial. So there's no multiracial category. And then actually, in some cases, another category is permissible. The two-question format here is that ethnicity, Hispanic or Latino, not Hispanic or Latino. This Latino overlay was actually predated 1997, but I think that the main changes were the disaggregation of Native Hawaiian Pacific Islanders from Asian, and that that a person can mark more than one race, and that there should be no multiracial category in terms of data collection. So these are socio-political constructs, should not be interpreted as being scientific or anthropological in nature, so be said. For the race ethnicity definitions, OMB defines them. They're here, so I'm not going to go through each one. I think what is important to note is for American Indian or Alaska Native is that it's the person having origins in any of the original peoples of North and South America, including Central America. So it's indigenous peoples of the Americas. And who maintains tribal affiliation or community attachment. So we'll get back to that later on as we talk about question wording. The other, I think, group to note, because there's been a lot of discussions of this, actually since about 2010 on disaggregating the Middle East or North Africa category from the white category. As of now, OMB standards do not provide that as guidelines. So there is no disaggregation in the guidelines for Middle East or North Africa, peoples from Middle East or North Africa, or the MENA region. There's the two-question minimum format that is suggested, and also based on several census tests that the Hispanic or Latino ethnicity question should be asked first. So the two-question format is you ask Hispanic or Latino, and then you follow up with the 5 major racial ethnic categories. And again, select one or more races is an option. There is actually a combined format, but if you read the Federal Register and OMB Directive 1597 guidelines, it's when self-identification is not feasible or appropriate. So the combined format then has 6 categories where the Hispanic or Latino category is then included in this combined format. Can select one or more races has to be also an option. I want to emphasize that these are minimum, and these are so that in case that it should not be construed as limiting the collection of data to the categories described above. And the categories should set forth a minimum standard, but additional categories can be permitted. So I put the link here. Oops, sorry, another poll. But let me just escape 1 second so I can put it, because I think that there's some sources that have been confusing. And I certainly in looking at OMB, there's some like, can you put Pacific Islanders with Asians? There are some sources in the internet that suggest this. So there's been some misinformation. And so I'm going to just say that if you are going to look at the OMB standards, that you use this link here. So I'm just going to try to, although I can't seem to find the chat function now. Here. I'm not sure I can get the chat function. So I will, 1 second. I'll do it at the end when AJ comes back and speaks. So doing another poll here, of the OMB categories that, again, there's 5 racial ethnic categories, and then there's 1 Latino Hispanic ethnicity category. Which one is most important to your work to increase data disaggregation on this group? So I'm gonna, this time I'm gonna be quick since I lost some time. I'm just gonna call it at 15 seconds. So do it very quickly, please. Okay, I'm gonna share the results, and what we see here is that we have 37% say the Hispanic, Latino, Latinx category is most important, and then the Black category and the Asian category, 22%, and the Native Hawaiian Pacific Islander category, 8%. So we are seeing, in the white category too, that there are then people in the room very interested in disaggregation across these 6 different OMB race ethnicity categories. So the Census 2020, I hope you all filled it out. Census 2020 had a new look than Census 2010. And so the Hispanic, it fits still with the 2 question, Hispanic, Latino, or Spanish origin first as the first question. And then, but with that, there's 3 subgroups, as well as a write-in category. So the write-in category was the big, I think, change here. Not big change, but it's been used more like also for the other racial ethnic categories. And then for the racial category, kind of as a compromise or maybe as a pathway to trying to get at the MENA population, the Middle Eastern North African population, that now the white category includes a write-in. So for example, whether if you say you're white, if you check white, that you can put whether you're German, Irish, English, Italian, Lebanese, Egyptian, etc. And similarly for the Black or African American population, if that is checked, then you're required then to check specific Black or African American ethnic groups. The American Indian, Alaska Native category, tribal affiliation is included here. And then again, to signal that it's not just the American Indian or Alaska Native indigenous peoples in the United States, but in the Americas, that it includes then, it signals to the respondent tribes that are in Central and South America. So for the Asian population, interestingly, there is no check, whether you're Asian or Pacific Islander. It goes directly into subgroups. And there are 6 subgroups here, the largest subgroups that are nationally, so Chinese, Filipino, Asian, Indian, Vietnamese, Korean, and Japanese. And then the Pacific Islander, the largest subgroups nationally for Pacific Islander groups, Native Hawaiian, Samoan, Chamorro, and other Pacific Islander. There is some other race option. So just a quick example of CHIS. This is from, again, California Health Interview Survey that I'm very, very proud to have been affiliated in over 20 years. Are you Latino or Hispanic is the first question. And what is your Latino or Hispanic ancestry or origin? And so we go beyond the 3 groups, but we go through, several groups that a person can check off. Just by the way, we used to do the survey predominantly via telephone, but now we're address-based, push to web. And so this, so about 90% of our respondents actually see this versus hear it and then do the check off. We do have still a telephone component because we found in our tests in our redesign experiment that for limited English proficient populations, for some populations that then don't have a stable internet, don't have a computer, don't have stable power, that the telephone still is really important to ensure that we don't have coverage bias. So, and then we go into, you say you're Latino or Hispanic, and then we ask the different racial ethnic groups. Also note that we disaggregate Pacific Islander from Native Hawaiian in this case. If you said you were American Indian or Alaska Native, then we have a follow-up question of what is your tribal heritage? And there's always a write-in, and these responses, I think, are the ones that we saw as being predominant in California. And as you can see, some of these tribes are not California tribes, but they're from other states. And I think that again reflects a lot of the nature of the demographics and geography of certain racial ethnic groups, and particularly for American Indians, Alaska Natives in California. It reflects a painful history of forced relocation to California. So then the question is, so you could be part of a tribe, but then are you enrolled member in a federally or state recognized tribe to avail of public resources? So really important to include for this group. And then we even go even more into, so you said you're Apache, and then we start getting into more granularity for American Indians and Alaska Natives in CHIS. Let me just go check. I'm getting pinged by my team in case, okay, there's a question in chat on the census. AJ, can you just read me the question in chat in the census? Because I can't seem to look at chat while I'm in this view.
No, it says, does OMB follow census/commerce practice of always placing the white category as the first normative quoted one group?
That's interesting. I don't think that there is, and somebody can correct me, a instruction on which group in terms of response set ordering. And it's, yeah, we have white category here, but I've actually been called by some of my colleagues that, we can put American Indian, Alaska Native, we could do it alphabetical, we could do it with the smallest group to, the largest group. So I think that's something like to explore, but I did not see any specific guidance on ordering of the response set. So the collection of race ethnicity is then we say, oh, I just went through that already. Asian. So the Asian population, lots of heterogeneity in language, which is most salient, particularly in quality of care. In terms of understanding, understanding your patients in language. So it's So the Asian population, this is an example of what we collect, again, beyond what's in the census 2020, the checkoff in the census 2020. And then you said you're Pacific Islander. So, we've already asked the question whether they're Native Hawaiian. So Pacific Islander, the follow-up category, what specific ethnic group are you? And then because you can check one or more, then we ask a question on, do you identify with any one race in particular? And I don't know if Jackie Lucas is on. I did see her register from NCHS. We've had lots of conversations about this question. This has been an NHIS, but although it's stopped, and part of it, there's some utility. There's some statistical utility in terms of making decisions about bridging multiracial respondents to single race categories. And it's much better than for a person to tell you if they do identify with one race in particular than a data analyst making some arbitrary decisions. So this is one of the reasons why we have, do you identify with any one race in particular? And then we ask, which do you most identify with? And I wanted to thank the OMB clearance folks for actually instructing us in CHIS. Before, we used to say, you said that you were, Filipino and Black and Samoan, and then which do you identify with most? And so going straight to being coercive and asking the respondent like that they were identifying, that they have a primary race identification, again, was coercive. So OMB actually told us, let's soften it and have, do you identify with any one race in particular first, and then which do you most identify with? We do have in CHIS, for those of you who are data analysts, something really interesting is that if you're Latino and single race, so you say you're Latino and you say you're American Indian Alaska Native, we also asked this question, a follow-up question. You said you're Latino, you said you're Apache. Do you identify with one in particular? And then which do you most identify with? Ancestry. So ancestry is kind of an auxiliary, important, but in terms of race, ethnicity, particularly for the white population and for the Black population, then getting at, questions about your background, what country were you born, what country was your mother, but then we also go into what country was your mother born, what country was your father born, to recognize acculturation and also immigrant families. And so we have a number of countries here. Also note that, I'm sorry, I thought I fixed this. If you can't see these links, again, we'll have these links available for you. That, for some groups, there's diaspora within. So country of birth for a Vietnamese who came as a refugee and was born in the Philippines should not assume the country of birth equals race. So acknowledging the diaspora. You also can't assume if somebody says Singaporean, nationality includes race. Like if you're Singaporean, you can't say they're Singaporean, but they could be Chinese, Malay, Tamil, South Asian, so or white. So I think it's and really important to understand that they're all they're overlapping, but not completely overlapping. So the Directive 15, as I said, we have these links here. So I'm going to go over some resources. The Institute of Medicine, now called National Academy of Science, Education, and Medicine, NASM, had a report in 2009. I was part of this report. But I think it's underused, but it's a good guidebook on both the collection, but also on the roll-up, which I think I get a lot of questions of, is that, okay, so we do all this collection, but in a county or a locality, but when we send this to the state or the feds, that then we have to roll it up, and can you help us? And so it's actually a great guide on the roll-up. I'll go over that in the next few slides. Some folks also don't really are aware that there in the Affordable Care Act, that there's a section 4302. And again, we also have the link here. And I'll talk more about that in the next few slides. And then, now that you've joined our community, you've signed up, we know who you are. The National Network of Health Surveys would be another resource. So on the IOM report, it was produced in 2009. And here I have the actual read and the page number because it's a little hard to navigate when you get to it. But there is a roll-up in table E1 that the committee put together that was based on, we looked at a CDC code set, a Massachusetts superset, census ancestry code list, Kaiser Permanente, and we did find that, again, the country or place names were interchangeably used for ethnicities in some cases. I gave the example of Singaporean. So we revised it so that it would be more about ethnicities as opposed to places. So whenever possible, this is reflected, and table E1 could be a good resource for you to look at that. It also includes groups where it's the granular ethnicities may not necessarily roll up to the 5 OMB categories. And so I think there's about maybe 20 groups, Brazilian, Cape Verdean, for example. So then the CDC also HL7 code set, though, is an excellent resource for an extensive list of American Indian or Alaska Native categories and codes. And so that would be a good template for those of you who are focusing on the disaggregation for the American Indian Alaska Natives. So 4302 also to remind folks, it's not just about race and ethnicity, but also includes guidance on sex, primary language, and disability status, and the new minimum data collection for race, ethnicity, and primary language. I'm going to show that to you here. This is the minimum standard. So as you can see, it's beyond the OMB standard for race and ethnicity. And it looks very similar. In fact, maybe it's identical, but different format and prompts as the Census 2020, where there is the 3 main groups for Latino, Hispanic, and then there's for there's American Indian Alaska Native. There's part of the current OMB standards here. And then for the Asian category, kind of the larger Asian groups here, and then larger Asian groups for the Native Hawaiian Pacific Islander category. So it looks very similar to the Census 2020. Now I can see the chat. Maybe now I can look at the chat here. Yeah, people are saying, look, alpha gun. All right, we'll get to some of the, like, how far do you go in granularity? And then let's see, some LA County, hello.
I'm tracking the questions.
Oh,
Ninez.
you are? No, I just want to say thank you to anyone who works at LA County Department of Health. Thank you for helping us fight this pandemic. Thank you. It's an uphill battle, but thank you. Okay, so I also think that the ACA section 4302, one of the best resources on describing it, is from ASPE, the Office of the Assistant Secretary for Planning and Evaluation from the Federal Department of Health and Human Services. And so we have the link here. So the ACA 4302 also included a minimum primary language question as well. So if so adding a question on that measures limited English proficiency because of a mountain of studies that look at disparities by language. And so this is, again, the guidance for Health and Human Service data collection. If you had real estate only for one question, the LEP, English proficiency question is suggested. If you have some space and look at optional granularity, then these questions on do you speak a language other than English at home, and then what that language would be, and ask of those 5 years or older. And see, AJ, where am I? I'm at 10. What mark am I? 30 minutes. Thank you. So, so here are the challenges. Latino Hispanic ancestry still collected separately from race. There was no change in the census, no change in OMB, but definitely there's lots of evidence, and I believe write-in comments that about 50% of Latinos will respond other. So it's sort of it's an imprecise measure. And then there were some testing, some recommendations that perhaps a combined format might be a better way of eliciting responses. But for whatever reasons, I don't have the reasons, I don't have the interiors of what the reasons were. The 2-question format is still recommended. Heterogenating the white population, I've mentioned strong advocacy from communities that serve the Middle Eastern, North African population, that this should be separated from the white aggregate race category. Again, there seemed to be some evidence that this is scientifically possible, but that there was nothing conclusive, so that again, it did not merit a change, or it did not get a change for the 2020 census. The heterogeneity in Black African-American category has also been raised, and particularly ensuring that immigrant versus native born and, country of birth, whether from a country in Africa or a country in the Caribbean, then I think more information on that. But some of that could be assessed through, if your survey or your data ecosystem has foreign-born versus native-born and country of birth. However, some surveys may not put country of birth. So again, that's I think something to consider to keep, particularly if you want to get at the heterogeneity in the Black African American and the white category. So another challenge is the increasing number of people who select more than one race. In 2010, 2.7% of the population. In 2019, these are my own calculations, that they may be a little off from what you see, but I looked at the 1 year 2019 American Community Survey that just came out about a few weeks ago, 3.6% of the US population. And then where that might be, again, also more of a challenge, that I note that for the smallest population groups, Native Hawaiians and Pacific Islanders and American Indians, Alaska Natives, that large segments of who respond one or more races, 56% of NHPIs and 50% of AIANs. Another layer of complexity, but I think can be solved, is that the single race AIANs are Hispanic. So say, okay, it's not about the multiracial challenge, but even among single race American Indians, Alaska Natives, that in some tabulation systems that they only, if you're going to depict American Indians, Alaska Natives, then you only get insights on single race, non-Hispanic American Indians, Alaska Natives. So for example, in California, the way we tabulate, the way the Department of Finance tabulates is if you're Latino Hispanic, then there's a category of Latino Hispanic, whatever race you are, even other, and multiracial. And then you have the non-Hispanic, all other. Racial ethnic groups. And so it misses then out on getting insights on both multiracial American Indians, Alaska Natives, and by Hispanic Latino ethnicity. So I'm sure there are more. I'm sure you're going to put in chat some more challenges, but I think these are some I think the big challenges that have been explored. No definitive answer, but I think I encourage some more exploration of that. And then I think Dr. Scheitler will talk about some of these opportunities for the financing of these explorations. And then measurement and classification of race has implications for health policy and health equity. I should have started with that, but you're all here today because you obviously have very strong interest in this. So the challenges, how do we pay for this? Why is it other challenges? But the other speakers in the series can talk more about, the disclosure risk problems, the oversampling problems that's needed, what happens, when you don't collect enough sample. But let's talk about how do we pay for this, and why it's important in the role of advocates and data equity champions. So case study number 1, community engagement. What and who should help lead decision-making? And I'm going to give an example of Native Hawaiian Pacific Islanders, and this is now with COVID-19. So we've seen the news. We track COVID-19 data, and we know that there's race ethnic disparities, disproportionate impact among communities of color. We hear a lot about the toll, the tens of thousands of Black lives that have been lost. In California, among the Latinx population, like one of the highest, both in the case rates and the death rates. So, but the data disaggregation, though, is still lacking even just the OMB minimum standards. It's among Asians and Native Hawaiians and Pacific Islanders. There are some data systems that continue to aggregate them. For example, Nevada and Clark County, Nevada. I don't know if there's anyone from Nevada here, but we've been tracking this group, the Native Hawaiian Pacific Islander Lab, that started from community engagement, community response, coming to UCLA Center for Health Policy Research, and then working on tracking the data, that we started noticing, so there was 1 week that the Asian group and the Native Hawaiian Pacific Island group was disaggregated, and then the next week they were aggregated. So it was very frustrating for the Native Hawaiian Pacific Islander community and the Asian community in terms of tracking the toll of COVID. So each state is collecting and tabulating race ethnicity data differently. There's some states that, most of the states do the Latino group, Hispanic group, and then non-Hispanic, non-Latino single race group, the multiracial group, and another group. But for, again, the smaller groups, and I'm going to talk about Native Hawaiians and Pacific Islanders, it's not, they either don't show up, and then if they don't show up, we don't know if they get put in the other category or the multiracial category, or just suppressed completely. So, and this is a problem specifically, and then it was community engagement that helped try to get attention, develop data, and advocacy. I'm just going to very quickly why race matters for COVID-19. It matters in the whole natural history of disease and recovery, and hopefully mitigating death. And it matters for susceptibility, for infection rates, and for the chances of recovering from this terrible pandemic. This is September in California. Sorry, I couldn't scrape the latest data for you today, but it's looking at this percentage of cases versus percentage of the California population. And so if the percent of cases or the percent of deaths exceed the California population, then the percent of California population, then there's an overrepresentation of cases and deaths. And so we depict that as just dividing the two. And so if it's greater than 1, then there's the toll is greater for this group. There's an overrepresentation. And as we see for the Latino population, it's 1.57 and 1.24 in both cases and deaths. But we don't know which, in crafting messaging, we don't know if within, whether these are predominantly Mexican Americans, or they could be indigenous Latinx, it could be Mixteco. We don't know, because even if then they say, for example, for indigenous populations in Central America, they may check AA, American Indian Alaska Native, but with the tabulation rules, because that they will say to Latin Hispanic, they would be put in Latino. So hard to tell then and detect within this group. Then how do you do the messaging in trying to mitigate the susceptibility, the infection rates, ensure that there's access to care? Oh, yes. Where am I?
Interrupt you real quick. Sorry. There is someone on from Nevada, and she says that, yes, they are trying to track health data. The Public Health Agency is trying to keep up with the data in hospitals, but Hispanic data is also being reviewed. So I wanted to let you know that. But we also had a question that kind of goes in with what you're talking about now. Have there been any, Rochelle asks, has there been any arguments against data disaggregation based on race, ethnicity, and gender?
Thanks for asking that, Rochelle. There's another group that's going to talk about that. So we're part of this RWJF family of data disaggregation illuminators, fighters. So there is a group that's looking at oppositional research that could probably speak more of that. But I do know that especially in education statistics, that there's a very vocal group of Asians that are against data disaggregation. And it's related to affirmative action, it's related to educational opportunity. I believe in Connecticut, there was some movement for data disaggregation and lots of opposition for that. But Rochelle, if you would like more information, we could connect you with our partners who's looking at the oppositional research.
Thanks, Ninez.
Okay. And also another interesting story. So we do have a further data disaggregation bill that became a law. It's called a HEAD Act that focuses on further disaggregation of Asian and Native Hawaiian Pacific Islander groups in education and health statistics. It was sponsored by Assemblymember Rob Monta, and it passed. But the first time it went to the governor's office, to Jerry Brown at that time, he vetoed it. And the reasons were he thought it would be divisive. So, but I think with advocacy and more, more listening sessions with him, that it was, then he eventually signed it. But I think that there's also some of the opposition could just also be that, oh, this could be more divisive for our country. It could be just more divisive in terms of fighting for resources. So,
Ninez,
yes.
Sorry to interrupt you. I just wanted to let you know that Naima Wong is actually on the call.
Yay, Naima. Naima, do you want to say something about the opposition research?
Looking for my mute button there. Yes, just put in the chat that I hope I'm understanding the question directly, and perhaps there can be some clarity that is shared in the chat box. But we haven't come across anything specific related to race, ethnicity, and tying it to gender. And happy to have more to fill in more details in the chat box and connect with the person offline if there are more questions about what we're learning in the opposition research space.
Oh, I must have misunderstood it. So was it specific to the intersection of race, ethnicity, and gender?
That was my take on the question, but I need some clarity too.
Yeah.
This is Rachel. I asked the question. I'm sorry for not clarifying. I meant race and ethnicity and/or gender. I'm sorry, but I'm just thinking broadly about the issue as it intersects with both areas.
Great, thank you. I did not see Rachel. I want to see Rachel. Where are you, Rachel? Thank you for coming.
No problem. I turn off my camera because sometimes it messes with the bandwidth.
Okay, so. Great. Thank you. On that point, we did some oversampling. So there, I don't know about the opposition, but there's promotive research on looking at these intersections of race, ethnicity, and gender, especially in the tobacco space, because for some groups, again, that there's a gender divide in smoking. And if you just aggregate without disaggregating by gender, then it, again, you obscure what the risks are by gender. So, and that has manifested in some specific asks of the California Health Interview Survey to do some oversampling, and I'll show you that in a minute. But thanks for that question.
Thank you.
Great. So, and then the African American population, I like. So we have to look at cases and deaths separately, because there's a backstory there, right? So if the cases are disproportionately high, then it suggests an interventions that need to get at more on the infections, but even more that maybe it's there's some groups like the Asian American group where the case rates are low. But if you work with community advocates in this space, the argument is that the testing could be low there because in actually not informal, but surveys that have been done in the Asian American community is that they're afraid the stigma of being blamed for the Wuhan virus, the Chinese virus, the anti-Asian hate that's been recorded, that they don't want to necessarily get tested because if they test positive, they would be blamed. So then the testing could be much lower in these groups, and so the case rates aren't high. So there's all of these nuances that that are for survey producers or data producers that you could really be informed by working with advocates and community groups. For the NHPI population, which I've just had such the privilege of working with since March of this pandemic, that it's, and now we have a lab, an NHPI COVID-19 data policy lab, where we track the data nationally for several states that report, as well as for counties, that then we are seeing that this group which is often overlooked in some of the narrative that we hear on racial ethnic disparities of COVID, that they actually are disproportionately represented in COVID in both the cases and the death rates. So just that, and this is just a screenshot of one of the screenshot products of the lab. Sorry, I have either a very nervous mouse or a very nervous index finger. So what we see then is this a screenshot of the COVID cases across the country, and the darker, the higher, but there's a lot of gray areas, or areas that do not even report Native Hawaiians and Pacific Islanders. And then there's a blog that talks about the OMB mandate and county and health affairs that I put here for those of you who'd like to take a look at that. So breaking news, and I got permission for this from Tukwach, who is from Asian Health Services. So Asian Health Services, it's in Oakland, Chinatown, put up a testing site that would ensure that this stigma and under testing among Asians would be addressed. And she's been working with this testing group. And then, so the racial ethnic data on testing is even more of a mess. I mean, we don't have as much that's available, although it's mandated starting August 1st of this year to collect race ethnicity data. But it's because you have commercial labs, it's harder to get a standardization across a plethora of different kinds of labs. That's not all under CDPH, for example. So this is actually one of the labs that that her group has been working with, yesterday was collecting testing data by these groups, and they're using the one question format. It's because Hispanic or Latino is here. But apparently starting today, they're going to start under the direction of CDPH. And if there's any CDPH folks out there, please corroborate or chat, but this testing site said that CDPH gave them guidance that they now have to collect with this much granularity. And the other interesting and important piece is that before the preamble, like the prompt into asking about race ethnicity was select one or more options. This helps the health department understand the impact of COVID-19. And now the narrative is this helps the health department understand the impact of COVID-19 across our community. So again, getting that across our community piece is in that language. I do note that this is slightly, there's actually a mandate right now. There's government code to collect granular categories of, so these categories here are actually in government code right now to collect like Cambodian, Chinese, Filipino, Indian, Japanese, Korean, Laotian, Vietnamese. And for, oops, sorry, goes my mouse again. And then for Pacific Islander, these groups, it looks like it's even gone further than current government code and adding now the MENA population, the Middle Eastern and North African population here. So think that this is like a late breaking news on testing. So back to my poll. If I can go back to my poll, let me just, I've got to go back to my poll. AJ, is there any way you can run it? I can't seem to see my poll now. Can you run the, does your organization explicitly put health equity? Thank you.
Ninez, I'd like to call your attention to the time.
Thank you. Okay, let's stop it. It looks good. I'm going to share the results and, oh, thank you. Thank you for sharing. 76%, 24%. Okay, fantastic. I just wanted to note that the California Health Interview Survey, from the very beginning, we had two main objectives, and that's to provide local estimates, to provide statewide estimates, but local estimates at the county level or larger county level, county group level. But we also had an explicit goal to depict statewide estimates that would track health disparities, health equity in California's population. So I think just even having that is very important. So case study number 2, I'm just going to go over this very quickly. This is about granularity. What the OMB does say is, sometimes populations are so, you may think maybe in a population representative study, sorry, my cat's here, would be, too small. And so of course it would depend that you may have to do something that's non-probability based or do some special studies. So again, consult with your community engagement folks and advocacy to make sure that you're not missing something in just, let's say, looking at the American Community Survey statistics on which groups. On the tribal affiliation, I wanted to note that, why does CHIS ask all those questions on AIAN tribal affiliation? Well, it's policy driven, it's about rights. And so we do ask, I think for some of you, you might say like which groups, and I would, the first would be for most other groups and for American Indians, Alaska Natives, is you look at population data. So you look at the American Community Survey, but there is a criticism on, I think that I think the ACS is trying to do better, but there's a criticism that the question is so deterministic. It's that, so you say American Indian Alaska Native category is to include any person having origins in any of the original peoples of North and South America. So, and who maintains tribal affiliation. So that one question is already so deterministic of saying, like, you only check this if you maintain tribal affiliation or community attachment. And so because of that there could be an undercount then of respondents who have that identity. It's already a very difficult question to ask, but then to kind of pigeonhole that, only check this if you've got tribal affiliation or community attachment. So that's why in CHIS we have the first question on, race question, and then we follow up with tribal affiliation. And so I have that here. And the, sorry. So then for smaller communities, I'm trying to look at all your faces for looking at my slides, so apologies. Note that the other limitation is that the American Community Survey, you have to wait for 5-year estimates to get at the smaller populations. And so again, that could be a rate limiting step. And you won't get it as the data as current, which is why to increase data quality, partnering with tribal communities, engaging and hiring experts. One reason why you have such a great American Indian Alaska Native Granular set of questions is that we did hire Delight Satter, who's actually now at CDC, to help design the survey. And so by having staff that then have affinity and attachment to the communities is really important to have. So last case study and last poll. AJ, could you run this poll, please? It's about language. Let's just run it for 10 seconds. I'm sorry, I have to mute it. So Spanish is predominant, and we're seeing some East Asian languages. So it looks like it's Spanish and East Asian languages. Okay, so a note that how do you choose? So in CHIS, we actually conduct a survey in several languages. And I also get asked, like, how do you choose? Like, assuming you have a certain budget. And the way we chose was we looked at the kind of dual criteria of the size of the population had to be large enough that in a probability sample with a 20,000 household per year, that we'd have, we would encounter that household in the probability sample, base sample. But we also want to make sure that there was, so if we did that, then for example, French would be included. But if we looked at linguistic isolation, and so those dual requirements of linguistic isolation, which is a census variable that asks if anyone in the household can speak English, and if no one over, I believe it's the age, there's 2 ages, 5 and 13, cannot speak English, then that's a coverage bias, right? So that those households, then we wouldn't be able to capture in CHIS unless we conducted the survey in language. So that's one way. And again, that was informed by a multicultural technical advisory group that we have in CHIS that has community advocates, direct service providers, academics, and actually some health plans that are in our multicultural survey group. So I think I just said that. I'm not going to go into the details of, so we conduct a survey in all these languages, and recently in Tagalog. And Tagalog has actually been interesting because we don't have as many Tagalog interviews or responses by web. And so the question then becomes, it's inefficient, should you get rid of Tagalog? So that's something we're grappling with right now. And my thinking on that is, let's wait until the census comes up, and let's really be sure that our survey vendor is doing its utmost and ensuring that we're able to, that interviewers are well trained, that we're eliciting, we're doing all that to ensure that we're eliciting responses from this group before we retire it. Okay, last poll. AJ, please. And I'm seeing there's 46 new messages. Let me look at this. Yes, Emily, we will get you those links out. I was trying to put it all in chat. The links that I shared. Thank you, Anna, about looking at the color, skin color. That's, which I can answer that today. Thanks, Royce, for answering some of the CHIS related questions. All right, so it looks like federal agencies are in this group, in this sample. 57% funding from federal agencies, nonprofit organizations, funders, I guess that includes foundations, state agencies, academic institutions, health insurers, let me keep going, healthcare system provider. That's great, I'm sure, and you can choose more than one. So if I were to choose, I would check all of those for CHIS. We are somebody has once said, Sandra Shuri, it seems like CHIS, we do a bake sale. You know, I do a bake sale every other year to try to get CHIS funded. So let's talk about funding in this remaining time left that we have here. So CHIS gets funded by foundation grant. I'd say about a third of CHIS is non-government, and 2/3 is funded by the state, as well as some counties who want to have oversamples. For example, San Diego County, I think there's a San Diego County representative here that funds CHIS for so that there's more granular geographic within San Diego estimates can be produced. California is very fortunate to have also some major state foundations that really believe in health equity work. And then you can have survey stakeholders also be helpful. There was about 2-3 years ago, there was some additional funds that could be availed of because I think the California legislature was preparing that the CHIP program, the Children's Health Insurance Program, would then not be reinstated, or that there would be co-pays then would be imposed on those who were in the CHIP program. It ended up being reauthorized, and so with those funds, then it was, what could be done with it. And so we actually had some children's advocates that went to the legislature and really championed the California Health Interview Survey in expanding its child sample. So again, advocates could really be helpful. Departments of Public Health, again, thank you. I'm a big fan. Would be, a funder, a big funder. I think the question here is some folks ask me, well, why isn't it all Department of Public Health? Like, why don't you have CHIS be all state funding, state health funding? Kind of similar to BRFIS, the Behavioral Risk Factor Surveillance Survey, which is CDC and state. But I think part of it is that part of what makes CHIS be so nimble and flexible and high fidelity to the community is that we do operate on a multiple stakeholder engagement model, so that there might be some things that are priorities of the state, but then may not be as aware of emerging needs that are happening in communities that frontliners, only frontliners could tell us. So we do like this mix, even though it is like doing a bake sale every other year. It does feel like that the product is much better with all these different ingredients of funders. Medicaid program match, we were inspired by Ohio. I know there's some folks from Ohio here with their OMAS, Ohio Medical Assessment Survey, and that you could also have the whatever state entity you have. In our case, in California, it's Department of Healthcare Services that administers the Medicaid program. You can make the case to the federal government that that's a Medicaid program, and then you could avail of the federal match to fund your survey. Revenue financing from sin taxes. So sin taxes, the taxes of tobacco we've heard of. Cannabis was recently legalized in California. So some of these sin taxes then, have gone through our CDP, California Department of Public Health, tobacco prevention branch. And so those have actually helped with a new study we have on respondent-driven sample for the Native Hawaiian Pacific Islander population. So again, like sin taxes could be another source. Hospital Community Benefits Program, the ACA put forth the community benefits programs, and we benefited from that for a period of time from a health plan from Kaiser. So, oh, sorry, hello?
For me. Oh.
I think I can hear somebody. And then NIH, we've received funding from the National Cancer Institute. So, but as a contract, not an investigator administered grant. There's still people trying to come into the room, I can see. So, and then some counties have asked us for San Francisco, again through tobacco, have asked us through a tobacco prevention program to focus, and this is the gender, race intersection, to increase the sample for Latinx males, Chinese males, and Black communities in San Francisco. So we've gotten that request. We've conducted 3 American Indian Alaska Native oversamples. They were funded through a community organization called CRIB, California Rural Indian Health Board, via a Centers for Disease Control and Prevention grant. We've also been funded by Indian Health Services on oversamples of American Indians Alaska Native. NHPI community organization respondent-driven sample that I mentioned is funded by our state tobacco prevention and control program. And then because we conduct the survey in Korean and Vietnamese, then to ensure that there's adequate numbers for that group, given that effort, that we do cover that in our core grant. So I hope I do have another poll. Oh, can you do the poll really quickly? AJ, can you do this poll? Thank you. And we're also going to keep the polls too. Okay. I'm going to share the results. So actually, most of you, well, 61% do live in states that that have some kind of mandate on racial ethnic disaggregation, data disaggregation. And so my last point is that, and as I have 2 more slides, I'm almost done, is that you need all ingredients, right? You need all forces. You need all forces. You need market forces, non-market forces, people power forces to make data disaggregation happen. And then this is a scientific forces. So this is a chart where I think if you first look just at the blue, And the blue line is where studies, this is a scrape of PubMed, and thank you, Riti, for doing this, Dr. Shimkata. So this is a scrape of PubMed studies where that have the scholarly peer-reviewed articles, and of course, they rest on good data. So where the blue is the aggregation of Asian and Pacific Islanders. So we do see an increase, kind of let's call it our control increase here. But you then also see an even greater rate of increase and greater velocity for the studies that are in green, which are Asian subgroups only, again, adhering to the OMB disaggregation of Asians from Native Hawaiian Pacific Islanders, or Asian only. So Asian only. Sorry, the subgroups are like say studies on Japanese, on Filipinos, on Chinese, and South Asians. So then we have of the Asian subgroups only. So we do see this increase. And then for Native Hawaiian Pacific Islanders alone, so not studies again that aggregate with Asians, we also see an increase. And so what I have down here are just some sentinel federal action and policies that kind of were the backdrop, instigator, the framer of why data disaggregation matters. And so we have from the Heckler's Report in 1985, Asian Pacific Islander Health Improvement Act, NIHS started to have subgroup data collection, National Health Interview Survey, apologies, an Office of Management and Budget 97, which we talked a lot in the beginning, occurred. And then we have the oversamples by National Health Interview Survey of Asians in 2006. I'm only focusing on Asians and Pacific Islanders in this particular graph. The ACA, the 4302 that I had mentioned, and then some special samples, oversamples for Asians for the National Health and Nutrition Examination Survey. And in 2014, the standalone survey and NHIS, National Health Interview Survey for Native Hawaiians and Pacific Islanders. So it's a very, so the mandates like help, but I also think that, so I'm putting CHIS, but for the data producers in this room, having that willingness then to adhere to the standards and go beyond the standards that reflect the diversity of the communities that you are trying to gain insights on, that it helps. So CHIS started about this time. And so, we kind of are saying like we're part of it, and we do have evidence. I'm not showing that, but we actually do have evidence where we scraped all the PubMed and saw that I'd say about 60% of these studies are using the California Health Interview Survey. So it's then really important then that survey leaders such as the NCHS, National Center for Health Statistics, that administers the NHIS and NHANES, and then us, CHIS, and so all you survey producers and leaders out there, that the mandates again help, but also that the commitment is really important. And for those of you who are just starting, hopefully some of these technical assistance will help. So at the end of the day, why do we do this? We don't just do this for data disaggregation's sake. For data disaggregation's sake, it's a means and not the end. It's so we have to deal with the growing racial ethnic disparities that we're seeing, especially laid bare under COVID. We're becoming more diverse, and then more data producers then need to lead, design, disseminate, apply, formulate with health equity at every step of this knowledge generation process. And we're here to help in those steps. And again, encouraging you to work with community groups, stakeholders, to ensure that what you're doing is not just about, say, population statistics that could be many years, a few years delay, but with community groups and frontliners that know what's going on and emerging in their community. So just as a I think we can get started. I'm just keeping this up here. We have a data release next week, so I'm just putting this up here. So how much time do we have? Let's go, AJ. Sorry, it took longer. We're at the end.
Now 11:30.
Oh, we're at the end, sorry. I can stay on for questions.
Okay. I don't know if any of the people who have asked some of these questions are still on, but Adrian asked the question, what would you suggest would be some of the best alternative practices to analyze data from multiracial, multi-ethnic individuals and to incorporate a more intersectional analysis?
So that's I'm like the analyst side. So I think if the data allows, so again, from the data production side, the OMB actually encourages the reporting of all the combinations of race. So for those that say, for those, and for example, the American Community Survey does that. So for those that say, again, that they're Black, Filipino, Samoan, that there would actually be a count if you're Black, Filipino, and Samoan. So then you get at the actual specific identities. But the American Community Survey can do that because it's a really enormous survey. For some of us, we just can't do that because of disclosure risk. At the very minimum, the data producers do need to have the multiracial category separate. So do not aggregate multiracial and other together. And maybe we might do it. I'm like looking at my CHIS, but it should be a separate category and not put with another category. I'm not sure I answered you, Adrian, but I think a lot of it is it's what your specific question is and what you're trying to get at with multiple identities, with intersectionalities. So it also depends on what your research question is, but hoping that you have the data that then gives you as much granularity as possible.
Early on, when you were talking about the Native American, Sarah asked whether or not the level of granularity getting down to tribe, how much it increases the risk of disclosure or re-identification.
So Sarah, stay tuned for an upcoming webinar that we'll have on disclosure risk mitigation. It's from somebody from National Science Foundation who will also talk about kind of what's kind of buzzing right now on differential privacy. So please stay tuned.
So there's a question that just got asked by, forgive me, Tynan. He says the ACS 1-year estimate for 2019 groups other Asian and Pacific Islander together. Are there ways that you recommend for statistically trying to separate out those groups from each other when they are not captured separately in the survey?
Oh, they should be captured in the survey.
Separately.
Yeah. So CHIS actually, that will be another webinar, or we should have another webinar on imputation, on modeling. We do impute race, which the first time when we did it, I was a little queasy about, but it is imputed in CHIS, and we can I can share it'll be one of the questions that we can share, like what the methodology is. I think with I'm a big fan of the sociologist Ruha Benjamin's work, and so any kind of modeled estimate is by design is going to have biases. So particularly if it's related to race, which is why I think that the designers need to get input from the community that you are modeling on to make sure that the inputs of your model, like I'm going to model like who I think is Asian and who I think is Native Hawaiian Pacific Islander, so that the inputs then make sense. Of course, the first thing just agnostically would be if there's language would be a good auxiliary variable, and country of birth, And if your survey asks parent country of birth, so you can get at the immigrant families. So I think that would be one. But again, please, if you are going to do any kind of modeled estimate, that you ensure that the communities that you're modeling are at that blueprint stage.
Ninez, I'm going to share my screen now and remind everyone of the upcoming workshops that we have.
Thank you. Thank you.
Absolutely. Other questions? Do you ask what race people typically ascribe to? The question is, if people are Afro-Latino and mark Hispanic, they may say they identify as with Latino ethnicity, but do you all ask if you are ascribed another race, how that may not match your personal identification?
So I think we try to get at that with the question of, you said you are Latino and you say you're Black because you're Dominican, say, then we do ask about, do you identify with one? And then which one? So we do ask that. And as I said, I don't know if other surveys do it, but if you're Latino and single race, so Latino and Black, Latino American and Alaska Native, that we do ask that question.
Great. Where is yeah, as you noted, we have a participant who works at a hospital in Los Angeles County, and he says that we are trying to disaggregate our patient data, but trying to do this based on our data for Los Angeles County. Wait, what is the question? Oh, how do we choose granular races?
So how do you choose so one way is to look at population data from the American Community Survey is done every year. When you get, LA is a pretty large county, so I haven't looked recently. Maybe you're able to capture some of that just with the 1-year data. The 2019 just came out a few weeks ago, maybe a month ago. If you're a smaller county, then you may have to wait until the 5-year data gets released, which is closer to the end of this year. So that I think helps then with looking at the trends of the population distribution, the composition in your county. And then with that, you work with community groups that, and I believe LA County has several task forces or groups. I mean, I saw Jocelyn Estendian here. Then to ask, the members of this group are these the trends? Are we missing anything? Or what's going on? Is this, to corroborate, expand the statistics that you're seeing from the American Community Survey. In terms of choosing, well, I showed you in California, there's a minimum set. I don't think many people know. It's beyond OMB categories. I think a lot of folks in California are looking at the AHEAD Act, which is going to be implemented July 2022, I believe, and which even goes beyond, like adds more granularity for the Asian population. But right now, there's actually quite a bit of granularity that is instructed by a government mandate.
So we have a question from Emily, who says she works with a state Medicaid agency that's looking to improve their race ethnicity data. And she says, are you aware of any work that has been done to quantify the minimum variable level of REL data completeness for analytics and reporting? They want to know how much data is good enough to start reporting.
Oh, I think that it depends. Like even within county departments, it's arbitrary, right? Sometimes it's suppression rules depend on the type of data system, like whether it's a survey or a registry, so sometimes it's like fewer than 10, fewer than 11 inches. Our cell sizes have to be fewer. We actually even go lower. We go to 3. And then there's a minimum for the weighted population estimates. So, and I know I have said on record that for COVID-19, that there should be minimum because imposing a minimum or suppressing, say at 11, and then all of a sudden the community, particularly the smaller communities, and again, the work I'm doing with the Native Hawaiian Pacific Islander communities, then you wake up one morning and all of a sudden there's 12 deaths that you didn't know about. You thought there was no problem, and all of a sudden there's 12 deaths, and 12 deaths, the rates are then increased for a very small population. So, so I think that again gets at another question. So don't suppress, but make sure, but of course there's going to be data disclosure and privacy issues. And so I think that's where, again, consultation with community groups in terms of getting so that they can have access, so that they know that there is a toll in their communities and what to do about it would be very important. So it's this balance of disclosure risk, and in COVID, it just changes the whole, all the rules of the game, because each day there could be a death and could really change the mobilization that's needed. That information could change that mobilization and could prevent the next death. So I guess my bottom line is it depends, but right now for COVID, I do not endorse suppression.
Okay, I'm going to take one last question. Is there any rationale for collecting all of the previous data under ethnicity versus race and ethnicity?
You mean like the one question versus the two question, or the wording race/ethnicity?
I am not certain if Catherine is still on. Perhaps she can clarify in the chat.
Maddie said imputation methodology would be super. Yes, Maddie, yes. I mean, I think that there's if it is about the two question versus the one question, there's been a federal roundtable that's been discussing race ethnicity data. I think that would be another good resource we can put. I didn't have it in the in my slides, but we can put in terms of looking at all the arguments and the tests that the census have done. There does seem to be some evidence that putting Latino ethnicity in one question would really help solve the preponderance of this other race category that gets checked off among Latinx respondents. We have people that want to come into the room right now when it's over.
I know, but you have a faculty meeting in about 15 minutes.
Right.
So we should probably bring this into an end, but thanks everybody so much for the discussion and your questions. We hope that some of the future workshops that we have scheduled will be further answer some of the questions that you have. Please reach out to me if you have any issues. Remember, we are going to post all of these recordings on the website in case there's any that you cannot join. And we will also be posting the slides from today, so you can get all of the links that that Ninez offered up. If you have any questions, please reach out to me. Thank you, Dr. Ponce, so much. Thanks to the CHIS team and to my colleagues at the center and our communications department for helping us pull this off today. We got a lot of interest and I really appreciate it and look forward to seeing all of you on a future webinar.
Thanks, everybody. Thanks, Dr. Scheitler. Also, thanks to our IT department. Thank you.
Yes, thank you to our IT department.